Welcome to GW Integrative Medicine, the podcast about disease prevention and health promotion from the Office of Integrative Medicine and Health at the George Washington University School of Medicine and Health Sciences.
I'm Dr. Lee Frame, Program Director of the Integrative Medicine Programs here at GW.
And I'm Janet Rodriguez, the office's Administrative Director. Today, we're joined by Sahar Swidan, PharmD, RPH, and many other initializations. Dr. Swidan obtained her Doctor of Pharmacy degree from the University of Michigan, where she completed a 3-year bio-pharmaceutics research fellowship.
She's the president and CEO of Pharmacy Solutions in Ann Arbor, Michigan, a unique personal and educational specialty pharmacy. She's a clinical associate professor of pharmacy at the University of Michigan College of Pharmacy, and she's an adjunct professor in our integrative medicine programs here, where she helps with our omics course.
She's an internationally known speaker in the area of pain management and the author of several books, articles, and patient education materials in the area of pain management and functional medicine.
Welcome to GW Integrative Medicine, Dr. Swidan.
Thank you. Thank you for having me today.
To start us off, can you give us a brief introduction on the history of the medicinal use of cannabis?
So, this was, Mary Jane, the plant, as I call it, right? This has been kind of vicarious, how everybody lives vicariously through that. We've had marijuana around, obviously, for many, many decades, but really only recently after the legalization of the medicinal uses of marijuana that we needed to embody the science and the knowledge in the medical arena. And I actually tease because I've been lecturing a lot on medical marijuana, CBD, and just the phytocannabinoids in general, which is really where the science is leading. But this has been kind of the difficult part for us. And I actually can give a lecture. I'm like, okay, the medical marijuana train has left the building, but really we have not done a good job of educating the professionals on medicinal marijuana, even the cannabinoids, appropriate use, potential side effects and adverse reactions, potential drug interactions that could occur from this. So as you guys know, this is really only in the last few years where medical marijuana has become, legalized for medicinal purposes and obviously in some states for recreational purposes. And I think now that's where really a lot of science is needed. And you can see since the legalization, obviously we are able to do much more our typical scientifically driven studies to look at this world, the appropriate use of this, the different disease states where patients may benefit from this, and most importantly, the safe of use of this. Honestly, I'm calling this, it's kind of the wild, wild west out there. And there, especially now with the legalization or the Farm Bill or, the legalization of hemp too, there's so much misinformation, I think, misguidance, and not necessarily the best products that are out there, because not everybody understands the role of and the importance of the appropriate development, following good manufacturing practices and things like that I think we should talk a little bit about that. But again, medical marijuana of just cannabis and CBD and phytocannabinoids, it's a very recent phenomenon in medicine that now we're really wrapping our arms around it in a medical way to elicit the appropriate uses, like I said, safe uses and adverse reactions.
You are channeling some of the things that we discussed a little more than a year ago when we did a medical marijuana and cannabis podcast with Dr. Misha Kogan, who's our GW subject matter expert on the medical use of cannabis and cannabinoids. But we also had a chance to talk with Dr. Don Abrams, who, as you know, is the guy. And if you could go in, talk a little bit about how the different delivery agents for the cannabis and cannabinoids can affect how they're going to react with a patient.
Yeah. So, I mean, let's start at 101, as I call it, right? So, I just did a webinar on this even just last week. And it was really what is the difference between medical cannabis or medical marijuana versus CBD versus phytocannabinoids? As you guys know from speaking to the experts you just mentioned, to a lot of honestly good information to misinformation that's out there, and just honestly, bluntly wrong information that's out there. There is differences between these, their clinical efficacy, safety profiles, and what is appropriate to use in what setting. So, medicinal marijuana, obviously that's the whole plant, which contains a lot of different phytocannabinoids, right? So you have, cannabis sativa and cannabis indica. And marijuana could be a species of both. And so that's the whole plant. So it has a mixture of what's known as the phytocannabinoids. Obviously, the most famous ones that everybody kind of knows about and probably the most well published is, CBD or cannabidiol or THC, tetrahydrocannabinol, cannabis. The problem with medical marijuana now is I tease and I say, hey, this ain't your grandma's pot of the 70s, right? The medical marijuana now in the strains, and because some of the genetic modification that occurred, it's very potent in THC, which, as you guys know, is the psychoactive component of the medicinal marijuana plant, at least the most psychoactive. Now, the marijuana plants, really, they have over 120 and probably more, 150 now is what the science is showing, different phytocannabinoids in that plant, right? So they have a lot of different actions, whether it's, good and bad, obviously from the anti-inflammatory to the calming effect, to the epilepsy control, to calming anxiety, to decreasing inflammation. But it also has some of the psychoactive component, right? Dulling your senses, slowing the brain down, to, hallucination and psychosis. It's very interesting, actually in states where legalized marijuana or recreational use has been legalized. A lot of my friends in the ER medicine world, tell me now it's crazy because, they have people, spectators, I guess, whatever you want to call them. They come to those states, they try marijuana or, for the first time or whatever. And because it's so much more potent now, the ERs are filled with these patients because of psychosis, psychotic breakdowns, hallucinations and things, because it's so much more potent. And it's really, breaking down their attention where they're not able to take care of like emergencies or real emergencies, if you will, like heart attacks and strokes and things like that. So definitely, smoking is not good. The problem also with smoking. So remember, when you have the whole plant, plants, sometimes they're grown with a lot of herbicides, pesticides, depending on the soil that it was grown in, if it was clean soil or dirty soil, if you will, because of many herbicides and pesticides that have to be used in different agriculture practices. So whenever you're smoking the whole plant, it's very important to really look at the certificate of analysis of that plant. What is the content of the cannabinidiols, the different phytocannabinoids? How much THC does it have? Is it clean of pesticides and herbicides? Does it have terpenes and limonene and things like that, which are the other components that really add to the efficacy? Obviously being in the healthcare field, I don't think smoking anything is good for you because you're not just smoking the marijuana, if you will, you're smoking all the other sometimes additives and things that are toxic, So I think other forms, are definitely much cleaner. Now in medicine, in medical uses, I think using cleaner extract, like full spectrum phytocannabinoids. So, and you can get now, that are organic, non-GMO, pesticide and herbicide free, and they don't have all the toxins. So whenever you use a full spectrum phytocannabinoid mixture that's organic, non-GMO, and clean, you can really control the destiny, if you will. And you can also get some of them, they absolutely have absolute zero THC. So we don't have to worry about the psychoactive component. So I think in medicine and for medicinal uses, that is definitely a cleaner form to use for patients. And you can also gauge the dosing, right? So for chronic pain, for example, most people recommend 2.5 to 5 milligrams of CBD starting twice daily, and you can increase it slowly. Probably the sweet spot for most patients with chronic pain and inflammation tends to be probably in about the 20 milligram range. So again, you don't need a lot. Everything out there, all we heard is THC-CBD, THC-CBD, but actually most of the science now is leading towards the use of this mixture of these cannabinoids because they have what's called the entourage effect. So all these different like CBDs and CBGs and CBAs and things like that really seem to kind of work synergistically because, the endocannabinoid system, it's kind of like the conductor of the orchestra. And because the endocannabinoid system kind of sits on top of a lot of other regulatory systems in the body, it's literally like the messenger. It's the modifier to a lot of messengering in the body per se. So it's really the conductor of the orchestra. And that's why with tinctures, what we're really finding, they're cleaner. You can look at the certificate of analysis, find out exactly where did it come from, from seed to shelf. I always say, you really want to know what happened to that product from seed to your mouth, before you put it in. And now sometimes for brain type stuff, whether it's seizures, anxiety disorders, things like that, sometimes we may need slightly higher dosing. Sometimes there may be additive potential of having very slight amounts of THC. So sometimes for, certain neurological indications, a combination of these mixed phytocannabinoids with a CBD THC ratio in the science now is showing us, hey, who needs just, these mixed phytocannabinoids? Who may need a little mixture with slight THC to kind of really augment the clinical effect? And now that literature is kind of making smattering, and coming into that world. And that's what's been the best thing of legalizing this, honestly, is because now we can study it in institutions and find out the clinical differences, but also these adverse reactions. Like, for example, very recently in Medscape, just a couple of weeks ago, I think, they reported this odd syndrome. It's called cannabis hyperemesis per se. So they don't know what causes it, but it seems like people kind of come in and it's kind of like, pregnant women when they have this hyperemesis issue where they're just vomiting non-controllably. And a lot of our typical medications that can help slow that down doesn't seem to be working for it. And sometimes it takes, 12 to 24 hours to kind of subside. So, that's the question now, like in medicine, like, what is causing that? Is it a certain ratio of THC to CBD concentration, or is it just way too much THC? We know THC can help with, like, sometimes, they use it a lot in cancer cachexia and chemo-induced nausea and vomiting, and it's helpful. But if you give too much, is that what trips people the other way, right? So that's what's been kind of really nice, is to kind of learn these clinical benefits, but also potential adverse reactions. And, I really have to, obviously, being a pharmacist and a PharmD, I'm like, we used to think, these things did not interact with drugs. But now we know, CBD, medical marijuana, which is full of mixed cannabinoids, can really affect the liver enzyme system or drug metabolizing systems. So they can slow it down. And so there's definitely some potential drug interactions that clinicians need to be aware of before recommending or adding, let's say, a medical marijuana, whether it's, vaped or ingested in edible or, sublingual, CBD or mixed phytocannabinoid tinctures. We really need to make sure that whatever we're recommending and adding is really safe with their current medication, but also supplement regimens. They have shown some supplement interactions in addition to medication interactions.
Thank you for that. That was very interesting. One thing that you mentioned was about smoking and how we would, as healthcare providers, never recommend smoking. And I know one of the public health concerns now actually isn't so much about smoking, but about vaporizing or vaping. Mm-hmm. Is that something that's being used for medical marijuana, or is it something that you would recommend?
So honestly, we don't recommend anything in the lungs, if you will, just because again, smoking and vaping to me are very similar because again, if the toxins or again, if you're starting with something messy, if you will, whether it's whole plant versus a cleaned out version, if you will, right? That's what ends up in the vape. Vaporizer cartridges and things like that, right? Usually it's kind of distilled extraction of, whatever plant material. So that's the problem is again, sometimes if you're not starting with clean source to begin with, it's going to end up in vaping. And if they don't have, again, good manufacturing practices, some of the medical mentality for this, if you will, not the industrial mentality where we are checking for all these potential toxins at the end of the process to make sure all of these things are removed. Sometimes the chemicals that are used in the extraction process are very toxic. So it's not just what the plant came in with, if you will. Sometimes the chemicals used in the extraction process could be toxic also. So again, with good manufacturing practices and things like that, a lot of times also you make sure whatever chemicals you used in the cleanup extraction process, if you will, is also out of the final product. So vaporizing, smoking, again, similar because the potential issues and toxins could be there. So what's left? Edibles, right? So, sometimes topicals, right? People, and I just talked to a patient at a consult. She's like, okay, I'm going to tell you this, but I didn't tell my doctor this, but my brother-in-law or something, she goes, he kind of makes his own salve from marijuana plant. And I was rubbing it on my trigger finger. Oh my God. And it worked so well. And then I was putting it on top of my knee and, and so on, like you always hear in pain patients, right? So, so the point is, there's topicals, right, that you can also get from, the dispensing shops, if you will, or people are cooking the stuff at home in their basements per se. So again, there's the topical administration of cannabinoids, right? And the phytocannabinoids for pain and inflammation, and then that leaves the edibles. Now, the problem we're finding with the edibles is I think that one is the most potentially dangerous because of potential overdoses. A lot of times people, obviously, they want immediate gratification and they want pain relief now. And so, they'll eat, let's say, whatever the recommended dose based on their dosing of, let's say, a brownie. And they eat like, let's say, a quarter brownie. And so, because with tinctures or vaping or smoking, it's very quick, right? Within 15 minutes to half an hour, they feel the effect. Well, with edibles, it could be delayed, right? So it could be an hour and a half to 3 hours, possibly, depending on gut motility of people, digestion, altered bowels, all that stuff that we tend to see with gut issues in the country. And so sometimes they may not get the effect until 1.5 to 3 hours. So then they go, oh my God, it's not working. So then they take another quarter and so on. And that's what we're seeing sometimes in the medical community is actually the overdoses are much higher with the edibles because of that. And so now with, CBD, the other, or, whether it's hemp or again, marijuana extract, with CBD or mixed phytocannabinoids, we really don't recommend oral ingestion because that they're very susceptible to degradation. So they're degraded a lot by stomach juices and things like that. Also, there has been some case reports in the literature where actually your digestive juices per se can turn some of the CBD into THC, which can make it a little bit more psychoactive. And they think that's potentially the reason why sometimes in pediatrics, as they were using lots of CBD tinctures for obviously epilepsy control, but they think that was the reason why it led, even though it's non-psychoactive, right, it was converted to THC and it led to some of the sedation, drowsiness and kind of hallucinations that sometimes we can see with THC. So for CBD or mixed phytocannabinoids, really we think sublingual is the best way to use them, and also you can control the dosing much better that way too. So we recommend tincture, sublingual administration for mixed phytocannabinoids, and honestly probably from a medical perspective that is the best and the cleanest one is to get an organic, non-GMO, clean mixed phytocannabinoid with probably no THC unless you have some of those other conditions, that we mentioned, because you can control it. It's clean. We can control the dosing much better. And also the effect is much faster sublingually than edible and some other things.
Very interesting. You sort of alluded to this already, but what are the leading contenders for disorders, illnesses, diseases that we can treat with medical cannabis?
So, it's interesting. Well, almost everything right now that, some of and why is that?
It's magic.
Yeah, that's why I asked.
Well, and the problem is, sometimes I always say, oh, it's the latest magic bullet, right? Every time we come up with something new, it's kind of like when methylation came out, right? Oh my God, everybody has methylation defect, right?
Yes.
Or mold and Lyme. Oh my God, everybody's got mold and Lyme, right? So, I just think we always have the buzz of the day or the buzz of the decade or the buzz of the year, right? But, but they're very interesting compounds, right? So again, I think the phytocannabinoid story, I'm not a huge fan specifically of medical marijuana, only because it tends to be smoked and vaped. And I just don't think that's very healthy for our patients, honestly, or like the edibles with the potential toxicities that we discussed. But is there a role for medical, cannabis and phytocannabinoids? Yes, 1,000% agree. And it's very interesting, they really can help a lot of things. So we used to think, you have these CB1 receptors that are mainly in the brain, but they're found all over the body, but higher concentration in the brain. And then you have these CB2 receptors, which are mainly outside of the brain. Obviously, you have them in the brain too, along the immune system, right? So we thought, okay, they kind of that helped your brain and this kind of helped your immune system, and there you go, done. But now what we're finding is that really, even CBD and these mixed phytocannabinoids, they don't even bind to these receptors specifically per se. Like THC, we know binds to the CB1 receptors much more preferentially. Now we're finding about these other, cannabinoids is what they really do, because the endocannabinoid system kind of, like I said, it's the conductor and it sits on top of the orchestra per se, that they really modify and modulate tons and tons of different signaling pathways, and they've shown a lot of different signal, like the TRPV1, the capsaicin kind of receptors, the PPARs, and many other systems, and so that's why they are touted to help just about anything, because it's literally the conductor of the orchestra that can modulate, like neuro excitation, like glutamate excitation, so anxiety, bipolar, maybe psychosis, right? But now if you give too much THC, you can elicit psychosis, right? So it's always with the body. It's about the balance, right? So I look at them as a modulatory system versus kind of like activating an inhibitory system, if you do it right and provide the right doses, for patients. Do we need the mixed phytocannabinoids? Yes. Do some patients need maybe a little more THC than CBD or the other phytocannabinoids? Absolutely. I think some of the science is beginning to show us the ratios in different diseases that are needing, but that's why you see them. They help with insomnia. They help with hormonal stuff. They help with infertility. They're helping with inflammation and pain. They're helping with seizures. They're helping with neurodegeneration. Couple case reports showed that they may potentially worsen Parkinson's, but again, that could be just a dose dependency thing that we didn't find out about. Couple case reports that it worsened tremor. But
Dr.
again,
Swidan?
Yes.
You brought something up that I really think it would be great if you could elaborate on, is what is holding us back in our understanding and use of medical cannabis in the U.S.?
I think really the main thing that was holding us back is really regulation, right? Because again, this is, even the endocannabinoid system, we didn't discover it. We have not known about this for like 50, 100 years, right? We just discovered this in the last 20 years, the endocannabinoid system in the brain per se, just in the last couple decades plus. So I think a lot of it was regulatory. I think a lot of it was stigma. right? A lot of it is kind of controlling the source. The problem is it's so hard to do clinical studies with something that can change literally from plant to plant and, next crop to next crop. It's very interesting, even clinically now with patients, even buying the same brand, if you will, of CBD, for example, you will see a lot of times they have to almost retitrate their dose with every new bottle because the certificate of analysis or the composition or the fingerprint, as we call it, of that plant can literally change from today to the next crop, right? So I think that's been what was holding us back. It was, A, legal status, B, stigma, C, funding, and D, how do you control a wild thing because it's nature, if you will, that can literally change from seed to seed, crop to crop, even within the same farm, right? Because, if you got too much rain, did you get enough rain? Is it too hot? Is it too cold? I mean, all of
Does the soil have what it needs,
yeah,
the nutrients
exactly.
it needs?
The nutrient profile will change because now, this crop sucked all the nutrients out of the soil and left the next crop with nothing. I mean, that's why it's like the wild, wild west, literally on multiple fronts. And I think that's why it's hard to we're like running, we're trying to get data from, a running target, literally, right? That's
Yes.
why I think it's difficult, honestly. But to be honest with you, some of the best data that we've had has been coming out of Europe and Israel because they've done, because it was kind of whatever legal. And really the drug or pharmaceutical type studies that we have, because we do have, THC that's been around that drug for, God, probably 25, even longer years now, right? THC that was used in cancer cachexia and, in cancer, nausea, vomiting, chemo-induced. Some of the other ones were a CBD THC combination. The more recent one, the Epidiolex, which was obviously approved by the FDA for seizures. But those are, very specific isolates. They're synthetic. And so they can control the journey every time, right? So some of the data that we're learning now really has been coming from either, European data, Israeli data, and some of the pharmaceutical drugs that we have. But definitely now I think that the lid has been lifted off. I think with some of the regulatory stuff, I think we'll definitely continue to see more and more scientific and more clinical
Something to
studies.
look forward to.
Yeah.
So I wanted to ask you, you sort of alluded to the fact that medical cannabis can be used for pain and it can be used for inflammation, and that it's difficult to work with natural products. So that applies to a lot of other potential treatments for inflammation and pain as well. Could you give us some highlights of a few others?
Yeah, absolutely. And that's why, as you've heard me lecture on this many times, right? The regulation of supplements and vitamins and medical marijuana is not a supplement, neither is CBD, as we all know. It's not under, with the FDA linked as labeled as a dietary supplement, right? So that's why even with CBD, mixed phytocannabinoids, any supplement and vitamin, you really have to know, again, from seed to your mouth, what has happened to that? What's the quality? What's the certificate of analysis of that? So, for example, another very commonly besides the mixed phytocannabinoids and CBD and things for pain, so everybody's heard turmeric, right? Curcumin and turmeric for pain, for example, boswellia, another great anti-inflammatory, very well studied in the literature. We have hundreds of articles on turmeric and curcumin and their beneficial effects in a variety of conditions, especially with pain, inflammation, even with cellular apoptosis, potentially in some of those treatments. So, but again, quality matters, because they're not regulated like in Europe. Supplements are very regulated, just like drugs. They undergo, they're called nutraceuticals. So here, there's definitely some governance, but it's very different, and it's nowhere near the governance of drugs, obviously, in this country. That's why it's very important for consumers to really look at the data. What makes a good curcumin? Curcumin, by fault, and turmeric is not well absorbed. So there has been some, extracts in the study, like the Mariva extract, for example, and they've done some studies to improve its efficacy and absorption. Patients want to look for things that are pharmaceutical grade supplement and vitamins. Why? Because pharmaceutical grade means that the certificate of analysis has been looked at, the raw material has high purity, low contamination, in that it meets a lot of the regulatory standards for excellent quality pharmaceutical grade type supplement. Some things like to look for, like USP verified, NSF verified. So these are, again, third parties that can give their seal of approval of the supplement that it's good quality. Another one that I love, as you guys heard me before, is consumerlabs.com. This is an independent third-party work group, if you will. And what they do is they really just take products off the shelf and they basically test them to make sure that these companies meet the label claim that they're claiming to contain X amount of whatever in your label, that it's good quality, it's safe, it's free of contaminants. That's the other huge thing that we all have to worry about with supplements and vitamin is contamination. I mean, they've shown, anywhere from, hey, this label says it has this much, vitamin or supplement or herbal extract in it, and it comes out as having zero or very little. Doesn't meet.
I couldn't agree with you more on that, actually. I even did my undergraduate thesis on that exact topic.
Yeah.
And we're still having this problem.
Many moons later, right?
Right. Yeah, you'd think we'd get it figured out.
Yeah, so that's the problem. So it's very important. So now that just means it's not going to work. But the other problem, which is really the other end of the spectrum, is the contaminants that we're finding sometimes in these vitamins and supplements. Because sometimes, they're made, here or abroad. They're made on drug lines. So sometimes some of the, like, erectile dysfunction, libido enhancing supplements are touted to kind of help with that. What they find in them is a lot of medications. So, such as like the Viagra and Cialis type drugs that are in these supplements because of contaminants, because they're basically pressed on the same line as the drugs and things like that. So very important to look for pharmaceutical grade, look for purity standards, go research the companies, look at their efficacy. Do they have any clinical studies? That would be the best. Hey, was their extract effective? Was it safe? What are the adverse reactions? The other huge misconception with just supplements and vitamins in general is, I hear this from patients all day long, right? Especially in pain, because they're so desperate they'll try anything. They're natural. They can't harm me or do anything or interact. And I always remind them, and I tease and I go, yeah, well, so is cyanide. Cyanide is natural too, but it can kill you, right? So, that's very important. Look at what you want to buy. Make sure it's pharmaceutical grade. Make sure it's got this USP or NSF certification. Make sure it has, or go to consumerlabs.org. I think it's only, I don't know. I'm not on their payroll or anything. So it's like, I love that website. It's like $25 or $30 a year, so worth the money to look and see what you want to buy. And if it's safe, effective, did it meet the label claim, all that good stuff that they test independently. And always make sure you check with your provider, healthcare provider or pharmacist to make sure that whatever you want to use is compatible with your current medication and other supplements. They do interact, like curcumin and turmeric interact. Boswellia can interact. Like we talked about, medical marijuana and CBD can interact. They can either slow down the metabolism of drugs or they can speed it up. And so depending on what it is, it can be bad either way. So very critical to go through those safety steps to make sure whatever you're using is safe, is effective, but most importantly, safe for you.
Yeah, that's a really excellent point. Going back to your statement about natural products, another natural product that we have seen being used and be overused for pain is opioids. And I'm wondering how we can avoid simply replacing one naturally derived pain treatment, such as opioids, with another, perhaps a medical marijuana.
Yeah, Very interesting. So, the book that I'm writing is Opioid-Free Pain Management. A very
Perfect. I didn't even know that.
Yeah, a very timely topic, obviously on multiple levels. So, and I'm also, co-editing and co-authoring it with a lot of brilliant colleagues across the country that kind of specialize in the different things. And what we're trying to do is to, again, really bring awareness because unfortunately, honestly, in school, this is what everybody was taught. We were taught NSAIDs are opioids for pain. Oh, and by the way, ice and heat too, right? So we really, we did not teach healthcare providers a lot of other modalities. And then, now we're calling it the opioid crisis. And I'm like, really? I mean, like this is a surprise to everybody. So anyways, that's the other thing, even with some of the detox strategies, right? So a lot of times we switch them from one opioid to another opioid. That's the detox strategy, right? It's a longer, and I'm like, how is that cleaning up and detoxing people, right? So honestly, I have major issues with that too. And that's another podcast and discussion per se. But that's the point. I think with pain management, it's a multi-system approach. It's a totally whole body approach. I mean, it's very interesting from, anywhere from gut health and that we've seen, how the gut talks to the brain, how the gut is 80% of your immune system. Inflammation most of the time starts from there, So it's all very important to address if we really want to control and heal pain, not Band-Aid it, like you said, because sometimes we'll go from one Band-Aid to the next. That's Band-Aid medicine. That's not really fixing the root cause, right? And also with opioids, we have to be careful because a lot of times they can cause what's called opioid-induced hyperalgesia. So sometimes the medication is actually making the pain worse, right? So that's where we have to really, I think, in the curriculum now, and it's great, with your university and many others now. I can't tell you how happy I am because I get asked to lecture to the M1s and M2s now. We're really starting much earlier to teach them whole body system and whole body physiology and better pain management, or as I call it, smarter pain management, no longer the Band-Aid, to really address from neuroinflammation to gut inflammation to the serotonergic pathways to the brain. How do we do limbic system retraining, and how do we kind of retrain the body from feeling the pain? How do we have, just like we have wind up of pain, how do we have wind down of pain, right? Artificial intelligence in that really cool new world that we're getting smatterings of now in the literature and how it modifies pain. Using, acupuncture to energy medicine to all that good stuff, to using some well-published, vitamin supplement herbal extracts. I mean, like PEA, for example, we have over 30 trials out of Europe about the amazing pain-relieving property of, it's kind of a phospholipid, lipid membrane stabilization and things like that. And it's an anti-inflammatory role, whether it's orally or topically for things like psoriasis and eczema. Just going back to CBD even and really the mixed phytocannabinoids, that's the cool new frontier now, is really topical medications for things like eczema, psoriasis and stuff, instead of using, especially maybe in younger kids, and we need the studies and the trials, but, instead of using steroids and worse, some of these immunosuppressants that sometimes, unfortunately, we have to use because right now it's the best tools that we have, So absolutely, it's really, we have to go to root cause medicine, if you will, now versus Band-Aid, especially with pain management, if we really want to make a dent in it and totally reform, if you will, pain treatment and pain management. So it's no longer just Band-Aiding, but truly, hopefully, eliminating root cause if possible, but if not, using this total body modality to truly give people better tools and options to use besides the opioids. Now, the opioids are appropriate for a very limited number of people. There are some people, they take their 3 or 4 Vicodins a day. They've used it for years. They're functional. It gives them their life back, So again, I always look at medications. They're phenomenal tools that we have that we need to use appropriately and judiciously in the right people. So, because, that's why I always I always try to stay in the middle. You know what I mean? Before it's like, before we were really loosey-goosey with kind of opioid prescribing, and it's like, it's okay, treat everybody. Everybody needs this. It's good for them. We can't have people at pain. Pain is the fifth vital sign, blah, blah. And now it's like, oh my God, don't touch that stuff and take everybody off of it. So now it's like, what?
Yeah, the pendulum swings.
So pendulum swings, and that's never good for providers or patients, because now we have a lot of people in pain. We've abruptly taken their kind of crutch or pain relief away, but we have not taught the system better ways to deal with pain, whether it's the providers or the patients yet. And so now they're kind of in the middle going, what do I do? Same thing with providers. A lot of them are like, their hands are up in the air, like, what do I do with these really tough people and these regulations now and things like that? So, I wish we just don't do these swings in medicine. Let's logically assess the situation. Let's look at who's an appropriate candidate. Yes, not everybody's an appropriate candidate for this, but there are some people now, where they had their life and everything and they were totally functional. And now they're like, basically we just kind of yank the rug from under them. So that's what I'm honestly working really hard across the country to just teach other modalities. And hopefully, as I said, the book was, God knows you guys know this, books are the worst ROI on your time life. A lot of people get divorced during book writing. It's just like, it's the worst ROI on anything, right? But especially my kids, my 6 and 7 year old are constantly going, seriously, mommy, all you do is lecture, teach, and write book, But the point is, I just felt like it was a little bit of a humanitarian effort, because we really do need to teach, and thank God we're starting at the M1s now to teach them the new ways to treat. But now we got to catch our graduated, people already and give them other tools in their shed to kind of hopefully help with pain management.
Yeah, we couldn't agree with you more. And I'd like to think that's exactly what we're doing here at GW with the integrative medicine programs. Yeah. And hopefully you and others are helping to spread that around. Unfortunately, that's all the time we have for today. I think we could have gone on for another hour. So we'll have to have you back on. Thanks so much, Dr. Swidan.
Absolutely. My pleasure. Thanks for having me.
This is the GW Integrative Medicine Podcast from the GW Office of Integrative Medicine and Health.
I'm Dr. Lee Frame.
And I'm Janet Rodriguez.
Thanks for listening.